Hey there tubies! Welcome back to our channel. Today, we have an important and thought-provoking topic to discuss. We'll be delving into a medical incident that occurred at a clinic in Singapore, shedding light on the actions taken, the consequences that followed, and the subsequent disciplinary measures. So, if you're interested in healthcare, ethics, and professional accountability, stick around and let's dive into it. The incident in question took place on January 14, 2017, at the Central 24 Hours Clinic in Yishun, Singapore. Dr. Tze Woon, a medical professional working as a stand-in doctor at the clinic, found himself facing a critical situation that would have far-reaching consequences. A patient arrived at the clinic experiencing breathlessness due to an asthma attack. Dr. Ho assessed the situation and instructed a clinic assistant to administer a nebuliser treatment to the patient, while still seated in a chair. A nebuliser treatment involves converting medication into a mist that the patient inhales, assisting in relieving respiratory distress. However, during this treatment, the patient's condition deteriorated rapidly, leading to a cardiac arrest. In a courageous attempt to save the patient's life, Dr. Ho immediately initiated cardiopulmonary resuscitation, CPR, while the patient was still seated. It's worth noting that CPR is usually most effective when the patient is in a supine position to facilitate proper chest compressions. The patient was eventually transported to a hospital but tragically passed away a week later. This heartbreaking outcome prompted an investigation into Dr. Ho's actions, raising questions about the appropriateness of his response in such a critical situation. Subsequently, Dr. Ho was charged under the Medical Registration Act for failing to provide professional services of the expected quality. A disciplinary tribunal under the Singapore Medical Council, SMC, found him guilty and initially imposed a 9-month suspension on his medical practice. Dr. Ho appealed against this decision, and his defense team argued that his actions were reasonable given the circumstances. They pointed out that the treatment room was small and chaotic, and Dr. Ho lacked training in patient transfer. However, the prosecution contended that Dr. Ho, who had training in CPR and prior experience with cardiac arrest cases, could have performed a more effective CPR had the patient been repositioned. During the appeal hearing, the court acknowledged the challenges of treating cardiac arrest patients outside of a hospital setting, where the chances of survival are typically lower. However, the judges emphasized that, as a medical professional, Dr. Ho should have been aware that proper CPR required a supine position for optimal results. Taking into consideration all aspects of the case, the judges decided to reduce Dr. Ho's suspension from 9 months to 3 months. They emphasized that, despite the tense circumstances, Dr. Ho's failure to reposition the patient before performing CPR was a significant factor in their decision. Interestingly, this incident was not the first time Dr. Ho faced disciplinary action. In 2021, he was fined and suspended for unrelated issues, such as downloading inappropriate material onto clinic computers and attempting to sell medication without proper authorization. Now, we want to hear from you, our viewers. What are your thoughts on this case? Do you agree with the court's decision to reduce Dr. Ho's suspension? How important is it for medical professionals to adhere to established protocols, especially in high-stress situations? Let us know in the comment section below. If you found this video informative and thought-provoking, don't forget to give it a thumbs up, share it with your friends who are interested in healthcare ethics, and if you haven't already, consider subscribing to our channel for more content like this. Thank you for joining us today. Stay tuned for more engaging discussions and insights. Until next time, take care and stay curious.